everyone for maintaining physical distance and wearing masks. We appreciate it. And thank you to all of you joining us virtually. I'd first like to start by introducing Augustana President Steve Balls.
Well, thank you so much for being with us today. This is an exciting day at Augustana College where a dream comes true, and that is that we get to open a health clinic at Augustana College. Thought I'd talk briefly about the history of our efforts to open a health clinic. It's been over the last several years that both students and faculty have asked the administration of Augustana College to have a bit more emphasis on health and well-being. To that end, a year ago, we appointed our first Director of Student Wellness and Resiliency, Farrah Roberts. To that end, we announced an $18 million project, the Peter Lindbergh, MD, Center for Health and Human Performance, to house a growing public health program, as well as a kinesiology program. But students have been consistent in my 18 years at Augustana College to say, President Balls, can't we have a health clinic? Well, finally, thanks to Dr. Lina Hahn and student government, students provided me with arguments that I couldn't say no to. Of course, it is time to have a health clinic at Augustana College. Augustana is a living and learning community, and although we teach our students, we learn much from our students. So to talk a little bit more about the genesis of this program with Genesis Health, I'd like Dr. Lina Hahn to come to the podium. Thank you, Dr. Hahn, for your leadership on behalf of our students.
Good afternoon, everyone. As President Ball said, I'm Lina Hahn, one of the public health faculty members here at Augustana College. I am so honored and overjoyed to join you today for this inspiring event as Augustana launches yet another innovation in health and wellness for our campus community. Believe it or not, prior to COVID-19, very few people actually knew what public health was or what public health students and practitioners do. But Augustana has been ahead of its time on the public health front for quite a while. We've seen students and alumni graduate with public health training for years, and we've watched them utilize their liberal arts education to solve pressing challenges in their communities and around the world for decades. Augustana's commitment to immersive hands-on learning prepares students to think deeply, collaborate meaningfully, and advocate for change. About an hour ago, I got to meet our newest group of health behavior and health promotion students, because this class walks students through the process of identifying health issues they are passionate about and helps them design and propose a health intervention to address that problem. It was in that class 3 years ago that Emma Larson and Corey Lapudra were able to propose the original proposal for a new health clinic by using our library resources to locate archival information about the clinic that used to be here many decades ago. Then, less than 2 years ago, Willa Karnofsky, Krishna Marme, and Sierra Rood, also all now alumni, built on that proposal and presented it to campus and community stakeholders, including President Balls. I remember how nervous and excited those students were preparing to present their ideas to such an important panel. But I remember even more clearly how the room erupted into applause when President Balls stood up, affirmed his support of a new campus clinic, and promised it would be here by 2020. Well, here is that clinic, and it could not have come at a better time. This clinic is the physical manifestation of Augustana's mission, to offer a challenging education that develops the qualities of mind, spirit, and body necessary for our students to pursue their calling of leadership and service in a diverse and changing world. Those students are now out doing wonderful things, serving their communities in places like burn and trauma clinics, as health policymakers and COVID laboratory assistants, among many other callings. So thank you to President Balls, Genesis, and everyone who made these students' ideas a reality. The work you do literally changes lives. And now I'd like to welcome Kirk Anderson, Augustana's CFO and President of Administration. Thank you.
Thank you, Lina. When we started this project, none of us were wearing a mask, and most of us didn't even know what the term COVID-19 meant. But we did know one thing, and that our students needed a healthcare service that was convenient for them in their daily lives and provided them general services so they didn't have to worry about other things as far as going off campus or going back home. So over this time period, we looked at different locations, we looked at different services, and we also received feedback from SGA in regards to what served the students best. I will definitely not claim that anyone here at Augustana can predict the next pandemic, but we do feel very confident that we can pick the right business partner. And that's why we feel so grateful today to be here with Genesis Healthcare. I would like to give some recognition to some departments that we've worked with here over the last 2 months, that being the marketing team, the operations team, the IT team, and also the IT team. In addition, I'd like to also thank the students here at Augustana College for providing the vision that we have here today, and also the advice from the faculty that helped us through this process. Lastly, I'd also like to thank our facilities group, particularly Bob Lanzarotti, in transforming a single-family house into a healthcare clinic over the last 2 months. And then, finally, I'd like to thank our marketing team for putting this all together today. With that said, I would now like to introduce Caitlyn Watkins, our SGA president at Augustana College.
Hello everyone, and thank you for joining us today. My name is Caitlyn Watkins, and I serve as the president of Augustana Student Government Association. Much like everyone else, I would like to take a moment to thank Dr. Lina Hahn and the students in her health behavior and promotion class, who initiated the idea for our health clinic on our campus. Because of this class and the students who took the initiative to take on this wonderful project, we are here today, benefiting our community in so many ways. On behalf of the student body, I would also like to thank all of those involved in this project, from start to finish, for prioritizing student well-being. By coming together as students, faculty, staff, and administrators, we were able to collaborate and make this clinic a reality in just 3 years. I have so much gratitude for the faculty and staff that truly value student input and allow students to share their ideas. More so, I am so thankful for those who allow students to collaborate on ideas so that students not only have a perspective to share, but an opportunity to be involved in the decision-making process. I hope that every time each of us walks past this health clinic, we are all reminded that students' voices are incredibly important to our community. As we someday recall this historic moment, let us remember that it was students who led us here. It was students who saw a need in our community. It was students who developed a comprehensive plan to address that need. And it was students who continued the conversations and continued to ensure that student well-being was a priority at Augustana College. This is a wonderful step and a monumental day, and we could not have picked a better time to focus on health and well-being at Augustana. I encourage students to make the most of this new service and to take advantage of the resources that are available. And let us continue to take collective actions as a community that promote well-being and prioritize the health of everyone at Augustana College. Thank you for your time. I would now like to welcome alumnus and administrative fellow at Genesis, Hunter Hill.
Thank you, Caitlyn. Let me start by saying I'm very excited to be back here on Augustana College's campus. I know it shared some of my most memorable experiences in my life here at Augustana College, both on the basketball court and in the classroom. With that said, I'm fortunate to be working for an organization partnering with Augustana College to provide care closer to home, or in this case, closer to college dorms and campus housing. I wish this clinic had been available when I was a student at Augustana. I definitely would have taken advantage of it, as I know I was sick a few times while I was here. An unplanned trip to a clinic can be a disruption of tight schedules, especially for active students on campus. This location will be convenient to students and faculty with minor illnesses or injury. Being in the healthcare field, I understand how important quality of care and convenience are to patients. This clinic will be very beneficial for students, faculty, and staff here at Augustana College. With that said, I would like to introduce President of Genesis Health Group, David Weiser.
Thank you, Hunter, and good afternoon. This is a wonderful occasion and very excited to be here. And congratulations to Augustana and Genesis Health Group and Genesis Health System for an incredible partnership. This partnership has been in talks for over a year, and we're excited to announce the Augustana Convenient Care Clinic powered by Genesis Health System. Special thanks to the Augustana team as well as our operations team led by Bo Dexter and Sandy C for their incredible work in putting this together. This clinic serves students, faculty, and employees and our clinic hours are Monday through Friday, 10 a.m. to 5 p.m. and Saturdays, 9 a.m. to 1 p.m. We treat an assortment of clinical issues such as cold, fever, sore throat, minor aches, minor fractures, and more. This location will provide a convenient location to clinical services locally. And one wonderful feature that I'd like to highlight that I wish I had at my health entity when I was in college is online scheduling. We have the ability for folks locally to schedule appointments online, which is great from a convenience perspective as well as reduces unnecessary exposure in the waiting rooms. This clinic will be staffed by an advanced practice provider, nurse practitioner, or physician assistant in partnership with a medical assistant. This practice marks a change in delivery. We've got convenient care in our health plexes, freestanding convenient care, high-V convenient care, and now we've got convenient care locally at Augustana College, and we're very excited to be here. So thank you for your time, and now I'm going to turn the floor over to Kirk.
Thank you, Hunter and David, for being here today and for all that Genesis has done. Originally had scheduled a ribbon tying ceremony around the pillars of the clinic itself. Rain has changed our plans a little bit, but we didn't want to cut the ribbon today. We wanted to join the ribbon to show the importance of this partnership in the Quad Cities. So thank you all. This concludes the formal part of our event. We will not be giving tours of the clinic just due to ongoing health concerns with COVID-19, but we do invite the media to stay around, and we're happy to help set up interviews. I am grateful